Mason one, obviously.
Mason one?
Yeah, of course. Of course, but Dan can fry fish.
Really?
Better than hell. Better than hell, sure.
Wow.
Hi, Joe.
Hi, Lady B in the house.
She says that's tequila. It's a margarita.
Ay, 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 ay. Ah, bienvenido IG, bienvenido. Ok. Estudes con Tricky, bienvenido a mi Instagram. Today in my closet. Oh, Remy cry. Hi guys, and welcome to another episode of Tuesdays with Tricky, where we take your mind off of what's going on outside the closet and bring you in here for an hour of fun, frolic, and foolishness. Okay, today I am drinking a strawberry passion spice, and you said this is with tequila? Oh, hello? Are you there? Are you there?
Sorry.
You just concentrating on Remy crying?
I am actually concentrating, and I'm so into the food that we have today that
you're really hungry.
I'm waiting for you to finish with your introduction so
Okay.
that I can introduce the food.
Okay. Introduce the food. The pregnant lady is hungry, so everybody make way.
So I
Tequila.
have been dying to try this place. It's called Hibachi-san. It's I guess like a Japanese style fire grilling place. It's in a food truck. It's on Kensington Avenue, 2.5 Kensington Avenue, right inside where Gym is, JYM Gym.
Oh,
yeah. And so they do the Japanese style noodles where they do the little cabbage, like teriyaki style. So they have shrimp, they have chicken, they have tofu. You can also get a rice bowl. They do beef and whatever. So I call them, they do not open on Fridays, because last week Fridays when I wanted it and I craved it, they do not open on Fridays. But they sent for us today. And I'm just really into this right now. Okay, this is yours.
pregnant woman is hungry.
Yeah. So I can't really talk to you guys too much.
Oh, it smells really good.
I know, my girl. Imagine. And when you get there, it's like they must sizzle upon the wok, you know? They must sizzle it upon the wok. Yeah. And you say, them just like, you know, because they're doing the wok style stuff.
Okay.
Yeah.
Okay.
So anyway,
Ooh.
show the people what you got.
Oh, you got tofu.
I got tofu.
So Tricky got tofu noodles and like we call it a stir fry veg.
Yeah, like a stir fry.
I got noodles, chicken, and my stir fry veg. It smells so good.
But they do shrimp, you know, so they have other options, and they do beef. And you can call Hugo to have them deliver it. And
Oh, that's good. I keep trying to do my noodles like this to put in Remy's lunch pan, and I keep missing the mark. What's the flavor on it?
Hibachi-san flavor. Oh my gosh,
It's really good.
this was worth the wait from Friday. This was really good. But I'm just so glad that they do tofu, because I'm trying to be vegetarian now.
Really?
Okay. Can I have a piece of your chicken? I just want to try it.
Oh, if you're trying it, you're still being vegetarian.
Karina says it's oyster sauce that they use to make it like this.
Really? It's so good. It's such an excellent flavor. Not too salty.
Oh my gosh, it tastes just like the mall food in Miami.
And you know, I love mall food.
Oh, mall food is the best.
Mall food is the best.
This is mall food in Miami. I'm so happy right now. Maybe soon start kick. Okay, so I also wanted to talk to you guys about the, was it Viewers Choice Awards? Was it Oscars that went on?
I think it was the Oscars, or was it the Emmys?
Emily. What was it? I don't know.
The Oscars? Grab your phone, girl.
Help me out now. But did you guys see Halle Berry? She does not age. Whatever Halle Berry, if Halle Berry came out with a skincare and like holistic health line, it would sell off. Who would not buy that?
Of course you'd buy it, but I mean, Oscars, thank you. The more money that you have access to is the better you can look if you wanted to, because treatments are available to you, doctors are available
really
to
look
you.
at Madonna. Don't find she's looking that great.
I just find she made a few wrong decisions with certain surgeries, but this is really good.
The tofu is perfect.
Somebody said I hated her wig. Yeah, it was very Dora the Explorer.
Yeah.
Halle Berry. I think it needed more of like a, not so angular, you know. She looked like a mushroom. She looked like the mushroom from Mario Brothers, but her dress was fabulous, her body was fabulous.
But you know, I like that she tries out different short hairstyles. Like she doesn't always have the same hairstyle. Like it's always like,
True.
she did the pixie cut. She did the Dora the Explorer. She does it dark. She does it light, you know?
I like that she switches it up, and that her hair is usually something short. You know, because not everybody needs to have long hair. Flowing down them back, you know? Can have like some short hair.
Somebody says the look that she rocked at the awards actually aged her.
Fitz just mentioned the girl.
Who's that?
Viola. She looked beautiful.
Viola, I think she won. For me, she won. Yeah, because like she had her hair pulled back off of her face. She had the little fro mohawk going, the white against her skin tone.
The styling of the dress, like how it fits her body and everything.
And it was so sexy. I mean, she's not a skinny girl by any means, but she always keeps it sexy with the voluptuous boobies. It had a cut holes.
And you look at her, and it's like, not everybody can have a short hair, long hair. Not everybody can be slim. And Viola shows us that you can be beautiful regardless. You don't have to be the stereotypical standard of beauty. Because every time she steps on that red carpet, she just looks so good.
Did you see Regina though? What was her name in the Louis Vuitton dress?
Yes. I actually saw that picture on Louis Vuitton's page, and I was like, damn, this dress, I wonder who is going to wear this. So when I saw the picture, I was like, okay, Slade. She had the height to carry off just the structure of that dress. Zendaya in yellow, she looked really good. She has such a model-esque figure that I think she can wear certain things and it just looks so effortless, so flowing, so natural.
I'm gonna agree with that.
Saturday.
You want some food? You just ate?
This is so good.
This is really good. You want to taste?
God, I just ate salad and you guys eating on shrimps and noodles? You know that's my favorite thing.
From her from?
It's okay. It's okay. I'm on a diet.
I'm on a diet.
Okay. So, right, so today we have some giveaways for you guys too. Sorry, this food is so good, I'm not stopping.
Yes, somebody's asking if this is a headband wig. It is.
Oh, it is?
Yeah, so on the hair, that's attached to the wig, and then you just put on whatever headband you want over it. I'm just trying different looks. I'm not going out for now, so I just decided to wear my little, this was supposed to be one of my Trinidad looks. So I just decided to wear it today. Be careful.
No, I like when the breasts show like this.
Yeah, but in a couple of little bits of moving around, you'll soon see them peek out again. So,
Don't let them wink at anybody, that's all.
They're not winking at anybody. They're covered.
Don't let them wink at nobody.
They're not winking at anybody, Sean. Don't worry.
Alright, my dear.
They're only for you. All right, my dear. Stand up. So, I just have on my bedroom slippers. So this was my outfit for Trinidad. Like, we vetted. Oh, excuse me. We vetted.
You can't wait to do that to put your hand there.
Alright, true, but if I go to Trinidad with and a nip jumps out, chances are, nobody will really
Just
see.
Just don't let it wink.
It won't wink. It won't wink.
Okay.
I look younger with the darker hair. Guys, I don't like dark hair. I prefer my hair light.
It's a nice change, but...
It's a nice change.
Actually, you used to have dark hair when you were younger. That's so weird. Like, she dyed it black when we were in high school.
I dyed my hair jet black in high school because it was blonde. And Sister Mary Catherine was like, you need to dye your hair. So I dyed it from blonde to like this brown color. And she's like, Miss Stewart, you need to dye your hair the color of your eyebrows. So I dyed my hair so black, right, that my mother had to come into school to apologize for me. I was like, but sister, you said to dye my hair to color my eyebrows. My eyebrows are black. My hair was so black that in the sun it shone blue. Black hair suit. Guys, man. I do have some boob tape, you know. I don't need it today, though. We're doing good.
This is so good. I'm so glad that we got this Hibachi stand.
It's really nice. I need to save some of these noodles for Rem. Did she have lunch?
She had soup.
Beef soup.
Beef soup?
Beef soup, yeah. And we have giveaways for the people. I didn't tell them.
Oh, sorry. I was busy eating. Okay, guys. So starting up.
Somebody said, Tricky, you hungry friend. Let me tell you something. These noodles taste so good. They're like crack noodles right now.
I believe it's May the 4th. We're looking at Read Across Jamaica Day. So Read Across Jamaica Day Read Across Jamaica Week was an initiative started by the Jamaica Teachers Association to bring attention to reading and how important and how fundamental reading is. So it doesn't matter what you're doing. You could be going on live. You got to read the comments. It doesn't matter in school if you're learning what profession you want to be. Reading is fundamental. So the Jamaica Teachers Association started Reading Across Jamaica Week. And before Corona, different schools would ask different parents, different celebrities to come into school and read a book. And I always took part at my kids' school. I've been taking part at different schools, so I'll be reading books and I will just email my video to the various schools. I love the kids. Any school wants.
Okay.
Sorry. So we're highlighting.
You just chat so much.
But you busy eating, so I can chat. Go on, eat, girl.
All right.
So I've been highlighting Jamaican authors. And today we would like to highlight Cubby the Donkey by Caroline Ann Grant. Okay, so this is her book. It's about Cubby the Donkey. I just got it, but you read it. Tell me about Cubby. Or you eating? All right, well, let's see.
Cubby, he's a donkey, and he was born in the time of Jesus.
This story is about Cubby the donkey who carried Jesus into Jerusalem. He had very low self-esteem, but all that changed when Jesus chose him. Oh, wow.
It's a very lovely story.
Oh, I just got goosebumps. We just lost connection, but it's back. Let's see, does anybody remember?
Not ask them where the food is from.
That's what I was going to ask. Tree. Guys, you can win this book. Tell me, where is the food that we are having today? Where is it from? And it's a winner that pops up first on our feed. Where's the food that we ordered today from? Should we give it to Belle? Okay. Read off her name, her spelling for me.
_BELLE. _ELLE. Belle L.
It doesn't matter where you are, we'll mail the book to you, even if you're in Jamaica or across the waters. We will mail out that book for you. And we have one more giveaway, so guys, stay tuned. Slim Slimmers is here.
Slim Slimmers. I love Slim Slimmers. Okay, so hi Passion. So we actually have a guest coming to speak to us today, and it is Dr. Daryl Daley.
We're going to talk about vaginas.
I think he's on. Doc, are you here?
We're going to talk all about vaginas.
Hi, Hibachi-san, J.A.
Hibachi-san, J.A. We just did a giveaway. Your food is absolutely great. I can't wait for Remy to wake up because she's a noodle connoisseur.
But I can, because if she doesn't wake up, me and the connoisseur around here.
Oh, Dr. Daryl is here, so let us... How do we do this now? It's a long time I had somebody...
Click on him. And go live.
Vaginas. It's all about vaginas.
Well, he is a doctor.
Hey.
Hi, Doc.
Hey, what's up? What you guys doing?
Nothing. Okay, so I've been trying to catch a live that you do. I believe, is it a Monday night or Sunday night? There's 4 doctors that are on, 2 girls, and then... So I try to catch it while I'm in the shower. And sometimes I ask questions, and I don't know if because my question is so raw or what, but I did have a question regarding some of the pointers that you guys brought up.
Well, how about we do an introduction for Dr. Daryl Daley? Hey guys, okay. Well, this is Dr. Daryl Daley. We talk about him quite often. He is a OBGYN. And his daddy is an OBGYN. And your sister-in-law?
Sister-in-law is an OBGYN.
OBGYN.
And my brother is a doctor.
And his brother is a doctor. Dr. Daryl Daley is located at
Gynae Associates. Gynae Associates, 23 Tangerine Place and Portmore Town Center.
That's right.
Aren't you in Spanish Town too?
Maypen.
Okay.
Maypen Hospital.
Yeah. So, Dr. Daryl Daley has gotten many a phone call from Jody and I. Jody with the foot. He's not even a foot doctor.
No, he gets calls for everything.
He's gotten a call from me about my bottom.
Everybody has. We just call Doc. We thank you for giving us your cell phone number.
Pleasure.
So anyway,
Pleasure.
Now that we've introduced Dr. Daryl, you can go on, Joe.
Okay, so my question would be, and it has to do with the topic brought up, is it possible to get an STD in your vagina and not in your bottom?
Definitely.
Okay.
The most common STD that could be in the bottom though and the vagina at the same time is HPV. Right? Because HPV.
Bottom?
Yeah, man. Yeah, you can. So like, all right, so you have HPV associated cancers, meaning like the anal cancer is one, cervical cancer, vulval cancer, throat cancer, penile cancers. These are the very few cancers we actually know what causes them, because other cancers we really don't know what causes them, but we know all of these cancers are related to HPV. So normally, if we suspect that you have HPV in the anus for whatever reason, we'll have to check, importantly, the vagina and the cervix, for sure.
Oh, wow. I just had a question. So, okay, are there different types of HPV? Because I hear there's a vaccine that you can give. I don't know if it's young teenagers or young girls only that can help to prevent this or to make the symptoms less. How does that vaccine go?
Okay, well, good question. So HPV is the most common sexually transmitted disease. It's very, very common, to the point that if you have had sex with at least 2 people, you're guaranteed to get one of the 300 types of HPVs. But for the most part, if you have sex with 2 people, you're guaranteed to get at least one of them. But for the most part, HPV is harmless. It causes no problems. Your immune system fight it, and you don't even have any signs or symptoms, right? No. But if it does cause symptoms, it will manifest mainly in women in the cervix. So that's why we do the pap smears. So we're actually looking for, so what will happen? Usually it takes about 12 to 14 years to change from pre-cancer to cancer. So the whole idea of doing a pap smear is to pick up these changes so we can treat them and prevent it from going on or getting to cancer. So in regards to the vaccine now, so the best time to give the vaccine is before you start having sex, because you're only going to get HPV if you have sex. True or false?
Oh, okay. True.
Yeah. So the best time, you want to have these antibodies on board years in advance. I mean, the average girl has sex at about 17 years. So you want to have these antibodies way on board to prevent HPV from causing any problems. So that is why we recommend we give it to you at 12 to 13. But women can get it up until 45, and men. I got my HPV vaccine about 6 years ago.
Oh. So men can get the vaccine too?
Man. Definitely.
Okay.
Definitely.
Okay, so something that's been coming up in the comments, something that I suffer with, I don't think you can get rid of fibroids completely. You know, we see a lot of the pages advertising things for fibroids, for, what are some of the other things that women have? Endometriosis. Let's talk a little bit about fibroids. And I noticed that women in the Caribbean, colored women, they suffer, they get fibroids more so than their Caucasian counterparts. Does color, does race have anything to do with fibroids?
100%. But one more point about the HPV, causes genital warts as well. Sorry, very important point we kind of forgot about.
Oh, so the genital warts?
Yeah, so HPV is caused, genital warts is caused by HPV.
They have to look for warty body.
Examine everything before you do anything.
For real, yeah, true.
Yeah, man, examine everything before you do anything.
Before anything, you know?
How about just put on?
Spread it.
How about just what? Put a what?
If you put a condom on, does that protect you?
Well, the thing about HPV, you know, HPV skin-to-skin contact. Remember, the condom just covers the penis. HPV can be on the genital area, it can be on the scrotum, it can be on the vulval lips, and you're not going to know. So the condom will protect the penis, but I mean, it's skin-to-skin contact. It's highly contagious, you know. It's highly contagious, and it's one of these STIs that condoms don't 100% protect against.
Oh,
so back to the.
So inspect for the warty body.
Okay.
Inspect. So back to the question about the fibroids. So yes, definitely fibroids. It's a non-cancerous growth of the muscle of the womb. Very, very, very common for, especially in Afro-Caribbean people. You brought up a very good point, Jody. It's very common in Afro-Caribbean people. We don't know what the cause is. We can't put a finger on it. It's not like so we know it's caused by HPV. The cause of fibroids is multifaceted. There can be a genetic link, there can be a dietary link, and there's definitely a race link because black women get fibroids. I mean, I was in England doing some training for a little bit, and I remember, I'll never forget, the doctor said, oh, this woman has large fibroids. And when I saw the size of the fibroids, I was just laughing. You know, they're making such a big deal about how big the fibroids were. And, you know, in Jamaica, we're taking out these massive, like 8-9 month size fibroids, you know? So yeah. It's fairly common, especially in black women. Very, very common. And the symptoms, as we know, heavy and painful, prolonged periods. Sometimes the fibroids can press on the bladder, make you want to pass urine all the time. It press on the rectum, give you constipation, and this chronic bleeding will just make you anemic and weak and tired.
Yeah. So how do you know when you have fibroids? Because I mean, Jody knew she had fibroids because her tummy was big and distended.
That was one type of fibroid. So I had them in 2 different places, Doc. Because correct me if I'm wrong. The first surgery that I did, they were able to go.
I wish you would let doctor answer my question first.
But he has to know there's fibroids.
I just feel like you're hugging the fibroid show.
I'm hugging the doctor.
Yeah, I know. I see that.
Okay, fine. Ask the doctor.
Thanks. So, Doc, how do you know when you have fibroids or not? Is it something that you should check for regularly, like when you do your pap smear? Like, how do you know?
Okay, very, very good question, Tracy. The truth is, most women have very good question. That's an excellent question. Most women have fibroids and they don't know. Like in Jamaica, unofficially, around 70-80% of Jamaican women have fibroids and they don't know. They're just walking around with it. But the thing about it, fibroids can either cause symptoms or don't cause any symptoms, right? For example, women get pregnant all the time. I'll be doing ultrasound and then come to me and they're pregnant. Oh, we did an ultrasound to confirm the pregnancy. Oh, you have a small fibroid there. Oh my God, I have a fibroid. Jesus Christ, where'd that come from, you know? Or the doctor examines you. You go for your yearly medical and the doctor examines you. And I know part of the exam is doing a pelvic exam. We put one hand inside the vagina. We're trying to feel the uterus. And if the uterus is enlarged, the most common thing to cause an enlarged uterus other than a pregnancy in a black woman is fibroids. But not all the time fibroids cause symptoms. So it's very important to have that in mind. A lot of women have fibroids and they can be very small and they can be very big and they can cause no problems at all. It's what we call an incidental finding or a buck-up findings.
Right. Oh, so what happens if you so you know, you just said that some fibroids don't cause any problems at all and some do. So is it only if you're having problems with your fibroids that you should get them removed, or should you get your fibroid removed regardless?
Why are you asking these perfect questions? She's asking these perfect questions, Jody. She's outshining you. She's outshining you. Well, the truth is, every patient is individualized. So how I treat you, Tracy, is not necessarily the same way how I treat Jody. It depends on the size of the fibroids, the location of the fibroids, and the symptoms of the fibroids. You know, so I have patients that, again, we find out by accident, but it's not bothering them. So the rule of thumb is if it's not bothering you and it's small, leave it alone. We can't just watch it. So we know it's there. You're under surveillance. We'll do a scan every 6 to 12 months to make sure everything is fine. But treatment is highly dependent on the individual and the symptoms that they're having and the type of treatment you offer, because you want to ensure that you offer the right treatment to the right patient at all times.
What is PCOS?
Gone up. Yeah, PCOS is polycystic ovarian syndrome. So that's how
because I see a lot of people writing it and asking about PCOS. Can we talk about PCOS?
We can talk about anything you want to talk about.
So what is PCOS?
And how does it differ from fibroids?
Yeah.
Big difference. No, very. So Jody, that was a good question.
Oh, thank you.
So PCOS, for all intents and purposes, is a hormonal imbalance in women. Essentially, how it normally presents, women have a lot of the male hormone called testosterone, and when these levels are elevated, insulin, that's the hormone that controls blood sugar, doesn't work the way it's supposed to work, and the hormones in the brain that control the ovulation cycle and the menstrual cycle, they get derailed. So what will happen? Women will have irregular cycles or no cycles at all, and they may have like excess hair on the face, they may have acne, you know, a lot of hair, and difficulty getting pregnant. So that is how women with PCOS will present. And when you do ultrasound and you look on the ovaries, you may or may not see a lot of small cysts on the outside of the ovaries. So it's very common as well. Actually, it's probably the most, I would say, after fibroids, I'd say PCOS is the most common in Jamaican women. It's frustrating, the frustrating thing to treat for the doctor and the patient.
So, yeah, I wanted to ask this. As a doctor, when you get a patient for the first time, right? And, you know, people think that you can just go to the doctor one time and then the doctor's going to fix you, give you a magic pill, and everything is okay. But, like, if they're coming in with some sort of, they're coming in with these conditions, how long and how many appointments do you generally suggest that people come back to? Because you're not a wizard and you're not a magician and you're not God, so you have to go through a list of things to kind of differentiate like what the client is coming in with. You might not get it right the first time. It doesn't mean you're a bad doctor. It just means you need to go down a certain list. So how many appointments do you think that a client will need to come in for before you can properly diagnose what is wrong with them?
I mean, all right, so I always tell patients, doctors are detectives. We're like Sherlock Holmes. We're trying to solve the mystery. So the mystery is whatever the problem you're presented with, right? So part of solving the mystery is we need to get clues. A clue is talking to you. A clue is examining you. And a clue is sending you for investigations, whether it be blood studies or radiological studies. And then when we put everything together, we can find out what the problem is and effectively treat it. Sometimes you have some straightforward cases. Women come in, heavy painful periods, you have this pelvic mass, you know what it is already, you know? And like, or even a discharge, but sometimes you have some complicated patients, you're really not too sure what's going on, and you really have to do your full assessment. But usually, in that case, usually by the second visit, once we have all the results, we know what we're dealing with. But at the back of our head, all doctors know what the possibilities exist, or all good doctors should know what the possibilities exist. And we're just trying to rule them out. So usually once we have everything, I would say by the second visit, we should be able to appropriately treat you, definitively.
So how often should we visit our gynecologist?
You tell me.
I think every 6 months, same time we go to gynecologist.
Every year. So I always, so there's this thing called the well woman visit. So most women go to the gynecologist when something is wrong, right? Oh my God, I have this discharge. Oh my God, my belly hurting me. Oh my God, something wrong with my breast, right? So that's when women tend to go to the gynecologist. But there's something called, or a concept known as the well woman visit. And what that means, nothing is wrong with you. You're well, you're a woman, and you're visiting your gynecologist. Whether to say hi, to chit chat. And at that point, with our full exam, we do all our necessary tests, pap smears, STI screening, dietary advice, exercise advice, anything you want to talk about, man problem, woman problem, anything you want to talk about, you know? We're there to chit chat with you. I love those visits, actually. I love when women come, and those are the longest visits, actually, when they just come in and just start talking about business and start talking about them boyfriend and how much bun them I get and what.
I love that one. So before I ask any other question now, how can you treat PCOS? Is it like you can shrink those cysts, or do you have to have them cut out? Can they get big, like how you said fibroids get big to be 8 or 9 pounds? Very good question.
Very good question, Jody. Oh, you know, very good. So, all right, the mainstay of treatment for PCOS, most women who have PCOS are overweight. 2/3 of women are overweight. So the main stay of treatment is weight loss, and this is wherever you're going in the world. North America, England, Australia is weight loss, right?
There's a main treatment.
So it's weight loss. So a lot of women, as I said, as I alluded to earlier, Tracy, a lot of women want a magic pill. They want something to they want a quick fix. So that is why I mentioned PCOS is so frustrating to treat, because a lot of women, they're demotivated because it's hard to lose weight, and they're demotivated because a lot of them want pregnancy and can't achieve the pregnancy. So it's like a double whammy, right? So when treating PCOS, you have to have the dietitian involved, right? You have to have a trainer involved, and sometimes you have to use some medication to try and manipulate the hormones, like the contraceptive pill, and sometimes you have to give them some, remember I said insulin is affected, sometimes you have to give them some diabetic medication as well. But the mainstay of treatment is 10 to 15% of weight loss. And the cysts don't get very big. They're very small, very, very small. Not going to cause any problems.
So birth control, I remember back in the day when I did sneak and take birth control, a lot of older people were saying that's not good for me. I'm going to be on it for so long. It will affect your hormones, all of this kind of stuff. Do you think that my fibroids or getting PCOS, do you think that could be attributed to birth control and taking birth control for so long? Is there any relation at all? Good question.
Good question. Good question. There's no real correlation with taking birth control for so long. You know, as I mentioned, regards both of them are multifaceted. The fibroids and the PCOS, there's a big genetic component that, you know, we don't really understand. And birth control, we actually use the birth control to help control the symptoms of the fibroids and to control the symptoms of the PCOS. Those are, in fact, gynecologists use the birth control more than using it for birth control. You know, we use it for controlling bleeding and to regularize a woman's cycle, right? We highly recommend for contraception, you know. So it's a very effective tool that we use in treating patients with these conditions. Very effective, especially if you're bleeding heavily. We want to stop the bleeding so we can build up back a blood count, so we can operate on you. We can use a pill for that, you know. So it's a two-edged sword.
Okay, so I've noticed a lot of vaginal wellness stores will sell treatments for PCOS, will sell treatments for various things. I want to bring up the yoni pearls. I haven't tried them yet, but I'd like to. But as Tracy says to me, she's like, Jody, the vagina is self-cleaning. The vagina is not meant for all of you to push those soaps and yoni pearls up. Would you say that, boy, it's okay, don't worry about it? Would you recommend a yoni pearl? Would you say, yeah, you can use it? Or you say, absolutely no? Good question.
All right. I'm going to answer this question very carefully. I have had personally, and with my colleagues, you can ask Michael too. I have had a lot of personal experience with patients having some bad experiences with the yoni pearls. I mean, you can get a big allergic reaction in the vagina. The whole vagina becomes inflamed. And, you know, sometimes they're usually in a cloth, and the cloth is a natural irritant, and it can cause the bacteria in the vagina to overgrow. And, I mean, I've retrieved so many yoni pearls out of the vagina because the patients come in and it's just a big flare, you know?
What in that yoni
there's
pearl?
not enough. Pardon?
What is in these yoni? It's like herbs, and it pulls out.
There's a lot of herbs, Chinese herbs and mixtures that are in them with different herbs that have been used for decades, centuries, you know. But the thing about it, there's not enough scientific. You know, you have people who have, boy, doc, it work for me, fine. You're one of the very few that it works for. Because it works for you, would I recommend it to give it to all my patients? No, because I have seen too much patients having a bad effect it for me to not recommend its use. But it's still being recommended and pumped regularly all over social media, even in Jamaica, you know, all over Jamaica. I just tell women, just be careful of what you put in your vagina, yeah? Vagina cleans itself.
Okay, I hear that. But one thing that I have been using, and I actually quite like, and it's another one of these things that sell on your vaginal wellness stores, is boric acid. Like if I feel like itching, you know, I don't wait for it to turn into a yeast infection. If I feel like, you know, you have that rough sex, you know, you need to kind of boric acid, I find can help with something developing into a yeast infection, or can help curb any itching or any swelling. What do you say about boric acid in the vagina?
Boric acid in the vagina, I'm not a fan of it as well, but you're going to find a lot of gynecologists that toe the line with this, you know, because people are doing research on it, but again, there's not enough to say that it works. I have had bad effects with boric acid as well, and you know what's in boric acid, Jody? You know what boric acid is used for?
Yes. But you know
she's
what?
a cockroach.
All right, okay. All right, so boric acid is roach repellent. All right, we use it to kill roaches.
Roach not go up in my boom boom, so I'm good.
I'd hope. No, but I mean, it's
Only
like
snakes.
I said, we're all we're all scientists at the end of the day, and things have to make sense, you know. And we, just like they're doing all these studies with the vaccine for the COVID-19, and they're doing all these studies to tell us which one is the best one, which one works the best. It's the same thing. Well, we don't have enough information to recommend boric acid internationally. If you want to do it and it's working, no problem. No problem. I'm not going to knock you for that. If you came to me before and you say, yo, Daryl or Doc, should I use this? I'll tell you no. But most people do what they want to do anyway.
Yeah. But do you find, though, that doctors are quicker to write prescriptions than to maybe say, hey, why don't try this herbal medication? Like, doctors are a little bit quick to prescribe.
Can I tell you something? There's something that I use very often, and it's non-medical, and it's it's all natural. When patients who have recurrent infections, I normally give them something called Lactobacillus acidophilus. That's basically a probiotic, and it's a supplement, and it works very well. I have had very good responses with that, and that is not a prescription. That is something you can buy on Amazon. You know, so I do believe that there are other methods. I do believe there are other ways to treat, but it has to make sense, and a lot of work has been done on lactobacillus as well. You know, and it's safe. It works. There's no altered effect, and you're just balancing the pH overall in the body and the vagina.
Okay.
I guess that would be like sometimes when I feel like a little yeast infection, or I felt a UTI coming on the other day, I took some cranberry pills. Yeah.
That will help. That will help as well.
So when you say lactobacillus, is that the brand, or that's the type of probiotic that you're
That's the type of probiotic. You just Google it on Amazon, or put it on Amazon, Lactobacillus acidophilus.
All right, Doc is going to send me a picture, and I'm going to put on my stories, guys.
Yeah, I'll send a picture. You can just show it. And there's one brand in particular that works very well. I'm going to send that one.
I'm going to message you, and you're going to send me the picture, because I know people are going to. I have another question.
You have a lot of questions.
All right, so you ask. I always have questions. You need to inspect it. And there's Doc, and I let people know this all the time, especially when I was giving the talk to one of my younger friends, right? Don't be afraid to search in your pum pum. Don't be afraid to know your pum pum. You have to look in there to see.
I just feel like the word
search, but you need to be familiar with your vagina so that you can know what is happening with it. You know what I mean? You need to know, are there warts? This is how it's supposed to look, so that you know, hey, something is wrong down there. I need to go to my doctor. You know, and it was hard for me to explain to my younger friend how to use a tampon, because the first thing she was like, lad, you touch it? It's like, what do you mean if I touch it? It's my vagina. Touch it all the time.
It's your own. Yeah. Embrace it.
Right.
Embrace it. But you're so true, Jody. I want to stress that point. Women need to be familiar with their body, and don't be afraid or don't be ashamed of it. It's one body God gave you, especially the female intimate area. You have to be familiar with what's going on, because STIs or anything can be so subtle, you know, and you can look at it, boy, this look funny, this smell funny, you know. Be familiar. Don't be afraid to touch it. Don't be afraid to use a mirror. Skin up your foot and look. Ask your boyfriend, your husband to look. Do not be afraid. Inspect all the time.
Right. Specky pum pum, it is yours. Your turn.
So Doc, of course, you know, I'm coming through with like a pregnancy pum pum question, right?
Yeah.
I have to ask.
No problem. I'll support you.
So I have two parts to my question. One part you already know about, but this is my first part. So like, you know, I'm pregnant and everything was going good and whatever, and then I noticed that my pum pum started smelling like pum pum.
Yeah.
Like it wasn't it was smelling like prep school sports day. Like I had run really long, you know. And I researched it on Google and everything is okay. But now coming down into like the ends of my pregnancy, like I'm 4 weeks to go now, right? I still have the smell. I use a pum pum wash, and now I'm feeling like my pum pum is very wetty, like I'm getting a lot of discharge. Is this normal?
Okay, so it can be normal. And what we have to remember, pregnancy is a very dynamic state for a woman. You have these hormones that are raging and they're at very high levels, especially coming to the end of the pregnancy, that can affect the normal environment of the vagina, right? The vagina and the cervix. So what you can have happening is you can have an increase in what is the normal discharge, what we call leukorrhea, which is very common in pregnancy. So a lot of women will say, boy, doc, I have this yeast infection, I have this BV. But when they examine them, you realize, because you know, most women have a normal discharge, true or false?
True.
Right? So when you're pregnant, this discharge can be exaggerated.
Right.
You know? So what I tell patients is sometimes the odor can smell, but anytime it starts to smell or it starts to itch, you get an assessment, especially if it starts to get very heavy. Very, very, very heavy. Because if I'm thinking heavy discharge just running down the leg, what I'm thinking about is did our headwater burst?
Oh,
you know. So that is why you have to examine. That is how I am thinking, you know. So especially a patient will call me, boy, doc, awake. And I had a patient just like that the other day. She called me and said, boy, it's running down the leg, it's running down the leg, it's running down the leg. And I said, come to the office, and so said, so done. I mean, her water ruptured. It's not like TV when the headwater bursts and they say, oh my God, the headwater bursts, baby come. No, that the baby can come like up to 24 hours after that. You know, premature rupture of the membranes. That's what we call it.
Okay. So does this wetty pum pum represent like some kind of like that she's turned on, or it's just mucus, or
it's just healthy? It's just healthy,
like a clean out.
It could be a combination of factors. So I have patients who definitely, when coming down to the end of the pregnancy, they get more excited, more sexually excited and aroused, you know. And as I said, once it starts to itch or have a very unpleasant odor, you need to get it checked out, because women are also at risk for getting increased bacterial vaginosis and yeast infection, especially coming down to the last part of the pregnancy. It's not uncommon.
Yeah.
It's not uncommon. It's not uncommon. So like I said, if something is off and you think it's really not off, just get it checked out. Just to make sure. Because what can happen now, if there's a bacterial vaginosis there and it's not treated, that can actually cause premature labor and premature rupture of the membrane. So it's very important to treat any underlying infection before it goes to the point where you have a bad outcome.
Okay. You know, I want to say thank you for sharing this with us, because, you know, going through pregnancy, I find that a lot of women have not shared a lot about the changes in their body. And
it's very hush-hush.
It's very hush-hush. And I'm a sharer. I'm a big sharer, and I like to know what's going on with my body. Nothing that I've been going through has been super abnormal, but at the same time, I want to know that things I'm going with, they are normal,
because nobody would really say, oh yes, and guess what, my vagina got smelly, you know, so look out for that. People aren't going to say that. You know what I mean?
I just want to thank you for answering these questions.
But I want to thank you for asking them, because it's it's personal. You're telling people if your pum pum smelly or wetty pum pum, and that's like the shame, and you know you're getting help, and you need to ask, and you need to let people know, hey, this is okay, this is normal, them things are up on.
But the second thing that happened to me, guys, while I was this is how.
You sure you want to share this?
I'm gonna share this one.
Lord have mercy.
I'm gonna share this one.
And on that note, I'm drinking my Lady B mixology. This is tequila strawberry passion spice. Doc, I should have sent you one, you know. Yes, man. Cheers, Doc.
Cheers.
So, this is how Dr. Daryl and I met. So one day I woke up and I went to use the bathroom, and I've been having constipation throughout my whole entire pregnancy. I've always had a little bit of constipation problems, but this time I went to the bathroom and I was pushing as usual, and it was painful. And then I went to look in the toilet after I did my poo, and there was so much blood in the toilet that, like, I freaked out. I started crying. I was like, Jody, I'm dying. I'm bleeding from my body. Like, this is a crazy amount of blood. Like, my porn star days are definitely over. I have no future on an OnlyFans page. Like, it's over, right? And so Jody was like, okay, call Dr. Daryl Daley. He always answers his phone, so he will be able to help you and prescribe something for you. And Dr. Daryl Daley was there for me. Like, without a doubt, he checked up on me regular. To this day, he still checks up on me. How's your bottom? Bottom is okay. But what was it, like, first hemorrhoid? So it was I had hemorrhoids too while pregnant. But I didn't know that hemorrhoids was something that women go through during pregnancy. I didn't know it. Normal. It
is. So, but when you're pregnant, all right. So I'm sure, Jody, you've been pregnant twice. You never realize your vagina look fatter, like in the pregnancy.
It went from
man. And there's a reason for it. So what happens when you're pregnant? The progesterone causes the blood vessels to get bigger. So when the blood vessels are bigger, you have more blood flow to that area. So everything, and you need to see, like when you're delivering a baby, that is when it's swell up like a mudfish. You understand? But the same thing for the anus, right? So hemorrhoids are basically dilated veins in the anus, and it's secondary to progesterone. So some women can have these big veins that are dilated, and they can actually prolapse and come out of the anus, and it can cause a lot of bleeding, a lot of pain. And how we treat it, basically, you can treat it surgically, but the best way to treat it in pregnancy is to treat it conservatively and medically. You try to give, you have constipation, we give you something to soften up the stool. We give you some medication to topically rub on the hemorrhoids, kind of make them shrink, right? But usually the hemorrhoids will fully go away after pregnancy.
Yeah.
You know, once you're pregnant and these hormones are raging, you're gonna have these symptoms.
So I do have hope in the OnlyFans career then.
You do have what?
I do have hope doing my porn star career then.
Oh yeah, definitely, 100%, definitely. Definitely.
I'm getting some questions in the comments here, and people are asking, do you take overseas clients, and do you do one-on-one consultations with people over the internet? Is that something that you do? Because some people want to ask questions. You're a very fun doctor. You answer the questions so thoroughly. The people are loving you right now.
Well, how would you do it? Could you put the camera by your vagina? Let me see. A little to the left. Put it out.
It's funny you ask that, because I do offer telemedicine services via this app called the MD Link. But I normally, what I recommend is that you give me a heads up, because I would have to schedule the appointment for you. You know, because if you go on the app, you're not going to see me there accessible all the time. Because the problem I was having, people would just be I'd be driving the car and I get a notification, you have an appointment in 1 minute. So I was like, no, I need to schedule myself. But yes, I do offer overseas consultations, specifically for infertility consultation. I do a lot of cosmetic work as well, cosmetic gynecology consultations. And if you want to send pictures, you can. I prefer if you email them to me, so I can. That is secure. That is, don't DM. I get a lot of DMs with vaginas. Guys, my social media manager has my account. Do not send me DMs of your vaginas. Please, Danielle will see it, and she'll see whose own it is.
So you just mentioned cosmetic procedures. Like, what is that you're doing? You can give me a tighter uku, a better looking uku.
Yeah, man. Can give you the uku. Can give you the uku-S. I can give you the uku-S. So basically, for all intents and purposes, I offer surgical procedures and non-surgical procedures. So the surgical procedures, that's laser vaginal rejuvenation, and it's essentially what we're doing. We're making the muscles of the vagina tighter, and we're making the entrance of the vagina smaller. So the whole vagina is going to be tighter, right? And for women who have long inner lips or labia minora, we can trim them down to let them look a little bit more aesthetically pleasing, So the non-surgical part, like the O shot, the orgasm shot, which will help you to increase your libido, increase your lubrications, it can increase your orgasms. And I also offer something called a high-intensity focus ultrasound, which is a HIFU, which basically breaks down the collagen in the vagina and restructure it. So it's a lot of interesting work. A lot of interesting work with some good outcomes.
And you know what I like about you too, Doc? You're very passionate with your work. So even when I see what you post and I see your captions and I see when you're
the pum pum,
passionate about the pum pum.
You have to be passionate about it. It's the most important organ ever.
Yeah, I agree. You're not only informative, but you're relatable, you're approachable. And we're seeing in the comments here where people are saying, I like this doctor. You know, you make it seem okay for us to ask anything. You know, you don't come across as judgmental at all. And we just, again, want to thank you for being here. And the people right, you know, very interesting.
Before we go, I have one question. Oh, I have one question to ask. Okay, well, I have a couple questions. Okay, Doc. So, say you're in the porn star career, right? And you use
you're going to be soon.
No, right. Just with my husband. Her only fan. He's the only fan on my page.
Okay.
So I actually had this conversation with my husband last night because I was flipping through and I saw a page that was selling different vibrators. And I said to him, I said, Scott, what do you think about this? And I'm asking you the same question too. So if I use a vibrator, and some of them are really thick and they vibrate and they do all this crazy stuff, right? If I use a vibrator and I use a vibrator a lot, and then I go to have sex with, say, my husband or a regular human being, like, doesn't the vibrator kind of stretch out my pum pum and make the feelings of my pum pum not really there for human contact?
What kind of size vibrator you use, sir?
I don't use a vibrator at all.
No, I mean, but
can stretch out.
All right. So sex. All right. Two things happen when you have intercourse. The more intercourse you have, no matter you can have, the more sex you have. Yes, the vagina is a muscle. It's going to get more stretch with time, especially when a child comes through it, right? So you have to bear that in mind. Definitely, the more partners you've had, the more intercourse you've had, the more after a while, it's going to get worn after a while. Very good muscle, and it has very good recuperate, but after a while, it can stretch. So I normally tell patients not to overindulge with dildos. Just get a regular size dildo. Concentrate on clitoral stimulation, right? Concentrate on clitoral stimulation. Don't concentrate on vaginal insertion, right? Concentrate on that because you don't want to be, again, you want to enjoy your husband, you want to enjoy your spouse. You don't want to know that you can satisfy yourself better with a toy than your spouse can.
Right.
You understand?
Totally.
Mm-hmm.
But then now you said that the pum pum, the muscle gets stretched out with the more sex and especially having a baby. So now after my husband has had the nice fat linguini pum pum due to the whole swelling of the pregnancy and whatever, and he's thoroughly enjoying that pum pum, right? He loves it. Okay. Yeah, but I mean, this is it's for everybody. Right, your boyfriend and your husband going to enjoy the fat pum pum. So now Stevie Glenn come and mash up my wall them and broke down my whole little muscle in there. Doc, how do I build back the muscles so husband can enjoy good? I can answer.
Good question, and I love that question because not everybody has. So the problem we're concerned about is the muscle to pelvic relaxation, right? So the muscles in the pelvic floor is just a group of muscles, and after childbirth, as you get older, decrease in hormone levels, these muscles can become weak. And the main complaint women will have is a lack of sexual gratification. So they're not enjoying sex the way. But not everybody has that. Most women will snap back and there's not an issue, right? But the woman who comes to me, like I give you a typical example. A woman will come in and say, boy, Dr. Daly, you know, I had my baby about 8 months ago. It's my second child, second vaginal delivery. And I'm not gonna lie, since then, sex just feels different. My man usually have a big hood, and it just feels different now. I'm not feeling him. I'm not enjoying it. I have to be faking because I don't enjoy it, and I definitely feel like some trauma has happened here, you know. And when they dig deeper into the history, realize, yeah, she does have pelvic relaxation, you know, like probably moderate or severe. And that is when we try to do the surgery that I'm talking about, the rejuvenation, to tighten the muscles so it can improve sexual gratification. So that is a way. A lot of women suffer and don't know, you know, that there are options available. A lot of women suffer. A lot of women suffer.
But I think Kegels are very important too. But
Kegels,
Kegels kind of, yeah, that's like a light work, you know. But
you said it well, Jody. So Kegels is good if you have mild relaxation, right? It can be mild, moderate, or severe. Mild relaxation, pelvic floor therapy, exercise, especially if you do supervised pelvic therapy, like with a physiotherapist. Like, so normally I routinely send all my patients after vaginal delivery to the physiotherapist just to get those muscles stronger again, routinely. So there is a role for Kegels, but if it's really, really bad, and the patients will know, sometimes the bladder will be coming down into the vagina, sometimes the rectum will be going up into the vagina, and the complaint is, doc, I'm not feeling my husband a concern. I'm not enjoying sex. And
any surgeries that you provide, the HIFU, the O-shot, the labia minora lessening, are any of those covered by insurance? Because at the end of the day, you know, I think all of those should be. As a matter of fact, those should all be free. Talk.
Free? How the doctor's going to get money? But okay, all right. So remember I mentioned the bladder can come down or the rectum go up. So when the doctor examines you and there's evidence of what we call a cysta seal, that's the bladder coming into the vagina, or a rectal seal, the rectum going in, yes, you can use insurance.
Hold on.
The other things, no.
What kind of diastasis recti with the things coming down, either the bladder or the rectum?
It's similar, but it's in the vagina though. It's similar, but it's in the vagina. So it's the bladder coming down. The women go through a lot, man. When I put in, I love her so much. You guys are queens, and you guys just deserve the best treatment because you guys, your body was just meant to go through a lot, and you just always just deal with it so well. Amazing creatures. Men can't stay like that. Men can't stay like that.
Women should be given a free BBL. Free.
True. No, you guys go through a lot, man. The battering that a pregnant woman goes through with the body, as I said, Tracy, you know what's going on. I mean, it affects every organ, the lungs, the skin, the gums, everything is affected. It's my father calls pregnancy a ticking time bomb. It's the most unstable point of a woman's reproductive career. There's nothing stable about a pregnancy. Nothing.
No.
Just pray and thank God everything is okay at the end, because you have a lot to be thankful for. That is the main aim. Mommy and baby are fine at the end of the day. That's what we care about. That's what we care about. By whatever means.
So ending on a positive note. Do you agree with this? Come here, agree. Maybe 3 months before you're to give birth, to kind of soften the area, to help with the stretching, to just massage the vagina area, the vulva, with a little bit of olive oil, because it can help with the stretching. Just like how you rub things on your tummy to help your tummy stretch, to rub that olive oil on your vagina to get your vagina ready for the stretching, just to prepare, to help with that big head that's going to come out. Because you and Scott head
so it's called right in the perineum, right between the bottom of the vagina and the anus. It's called a perineal massage. And sometimes, I don't really do this, but I know some doctors do it. They will actually send you to the physiotherapist before you get pregnant, before you deliver.
Oh, really?
You know, I've never done it before. Yeah, man, they'll send it to the physiotherapist. You like the 2 or 3 sessions before delivery. So I do the rest after. I normally send it after, but they will help. They'll help with the massages, and there does have a role for it, definitely. Perineal massage, very important.
On YouTube, and then Sean helped me. I would let him watch a video with me. Well, we had to get back to the massaging after the massage. But Doc, thank you so much. Give us your information, where we can find you, how to make an appointment. Mention again all of the clinics and the hospitals that you work out of.
So I'm going to make this easy. All my information is on my social media, on my Instagram, at Dr. Daryl Daley OBGYN. All the office information is there, all the individual office numbers. I work full-time for the government at Maypen Hospital, and I work privately at 3 different offices, but I'm very accessible. That email address on my page, that's my personal email. Nobody else is seeing it, so I always encourage patients to email me, and I have a good turnaround within 24 to 48 hours. Usually less than 24 hours, I respond. You'll always get a response. I'm very accessible.
Always get a response from Dr. Daryl. Always.
No matter what, if you send an email, you'll get a response. You'll get a response. I try to make myself.
If you were a woman,
you can ask anything you want.
Would you rather tear or get an episiotomy, and why?
Oh, me? Can I tell you something? It's good to not tear, but a lot of times I routinely give an episiotomy, you know, because it makes the delivery much easier. That's just my approach, you know, because a lot of times when it's much easier to stitch up one cut versus multiple cuts all over the vagina. So I find, and this is something my father taught me and my boss taught me, is you have more control of the delivery when you do it. And you don't have to give not big episiotomy, just a little episiotomy just to let the baby head come out more, because trust me, when that vagina is torn and you have about 50 lacerations to repair, you can be in there for 2 hours. Versus this one, after the baby born, 15 minutes you're out. So I tend to routinely give it. I mean, if the baby is small, and I watch, because you have to watch the perineum, you know. You can watch the skin stretching, and you'll know when it's about to tear.
Okay.
So when I know it's about to tear, I will do the episiotomy at that point. But if I don't see that stretch, I'll allow it to deliver.
But
it makes life much easier.
Yeah, I said, only give me the episiotomy if you see the tears starting to get bad. And he didn't give me one. He said you got 3 small little tears, and those are fine. But
yeah, man. But Jody, you can see it sometimes when it's about to burst open. You can't miss it.
Yeah. Okay.
I remember that.
Doc, when Corona and the pandemic is over, can I come and watch a delivery, please?
Of course.
I can pass
once the patient them are
the pliers, the hammer, the scalpel.
Why don't watch them deliver Tracy, baby?
Doctor, thank you so much. We are going to put all of your information. We're going to post this one straight to IG, because when we do these interviews on YouTube, you can't really see the doctor and you're just seeing us going like this in the YouTube camera. So we're going to post this right now to IG. We want to thank you so much for coming on, and we welcome you back anytime you're ready to talk about some more pum pum.
Anytime you want me, I'm accessible. I appreciate it. Thank you guys. Love you both. See you soon.
I love you too.
All right. Take care.
Okay. Bye.
Okay, guys, that was Dr. Daryl Daley. You can find him on Instagram at Dr. Daryl Daley OBGYN. We love Daryl Daley.
We love him.
He's so real. He's so real.
Like to call him on the phone, like when Tracy was like, my body was so burn. Like
I know.
There's no judgment.
And I didn't have to pretty up anything for him. That's what I like. I don't like when I'm talking to somebody and I have to be like, well, you know, so I was having a tad bit of bleeding. I was like, no, doc, I think I'm dying.
So we have one more giveaway of our book, Cubby the Donkey. What should we ask? What should we ask? What should we ask? You going back on the food, girl?
Yeah. Sorry.
The food today is from Hibachi-san. The doctor today was Dr. Daryl Daley.
Give me some of the other options.
The juice today is a Lady B mixology.
What are some of the other options that Hibachi-san has?
So some other options are, you have chicken teriyaki, shrimp teriyaki, beef teriyaki, tofu teriyaki. Then you have bowls, you have entrees, you have combos. You can get a chicken and shrimp. You can mix the shrimp with other things. You can mix it tofu.
Do they have any salads?
They have salads. They have a hibachi-chan chicken salad, a shrimp salad, everything. Hibachi-san, what heap of things. You see, when you're hungry, eat hibachi-san. You see, when you put before you go to Dr. Daryl Daley. You see, when you're thirsty, you drink Lady B's. You read a book. But hibachi is about to die, everybody. Hold on, let me plug it in, because we still have a giveaway. We have a giveaway.
Yeah.
Trey, what's the giveaway?
So we're giving away one more Cubby book, Cubby the Donkey. It's by a Jamaican author. Her name is Carol Ann Grant.
Yeah, Doc is.
Belly.
Wow. Sean's question is.
No, yeah. I do want to ask him, how come Pum Pum love me so much?
Oh! Sean Henriquez. Can you guys hear him? I hope you can't hear him now. You're going on their dream for that. All right, our last question of the day is, Food for the Poor JA is here. I did have some things I wanted to mention since we are plugged in. I posted on my stories earlier. We have, so we're still doing our drive for the volcano relief in St. Vincent. So Rainpower Seafoods has theirs going on, and in my stories you will see where you can donate to. And then of course the one I was donating to from Jamaica with love from the Patriots, and the Patriots finish on May 13th, and Rainpower Seafood finishes on April 30th. So guys, any nicotine goods, anything like that? I was working on Friday with Food for the Poor and the Sean Paul Foundation. You know, some I love the little work where, you know, just give back. Got to give back, people. Got to give back. What is our last question? What is Tracy having in her, what meat is Tracy having in her
hibachi stand?
In her hibachi stand there. You will win yourself a book. It doesn't matter where you're from. We will mail you the book.
Oh, Jody can't watch my delivery because of COVID. Only one person is allowed in the room, so Scott says he wants to be in the room.
You spelled it wrong, Jan. Right?
Jan.
Jammy Jams.
Jammy Jams.
Jammy Jams. Sorry, Jamie Jams. JAMIJAMZZ. You won yourself a book. I will DM you the winners. That's
Jamie Jams.
Jamie or Jammy Jams?
I think it's Jamie.
I think it's Jammy Jams.
Okay.
You want yourself a book? I will message you. And the other winner is, where's the other paper? Oh, Belle L. So I'll message you to see what your address is to mail you out your book. Guys, thank you so much for joining us. We will have more giveaways next week. Make sure you stay tuned to the Mecca Jamaica page because we're going to announce what the giveaways are. And if we're having any guests, I have some good guests and all. I have some good guests.
I don't think we're going to have a guest next week.
We like the guests then.
You like the guests?
Yes, I like the guests.
You do? We can have a guest next week then.
Maybe. Because you see, when we have a guest, it's so difficult to run it on the YouTube.
Yeah, that's the thing.
And you know, we need YouTube coming in some money. My breast them still have to do again. Yeah.
They look very stiff.
Really? You know how much time Sean trying to leave here today?
Just come and kiss your wife and done.
All right, everybody. That's it for today. Oh, sorry. Tricky's Corner. Tricky's Corner.
Oh. Bye.
UN is here. Big up to all the police officers.
Sean is talking.
Bye.
Bye.
Sean hide out in the bathroom the whole time. You know, him say hide out because he don't want to hear the pum pum argument.
No, I'm gonna hide out to learn some things.
Oh, all right. See you later.
Bye. So Tricky's Corner today. What am I going to talk about? You know, I want to talk about something that's been going on personally in my life today on Tricky's Corner. And that is dealing with adulting. So, really enjoyed that, eh?
So good.
So, dealing with adulting. So, I mean, you know, as you guys know, Scott and I are having a child and whatever. And one thing is thinking that, oh, yeah, I want to have a baby. And the next thing is like, when you actually have the baby in your belly and you're going through all of the motions and, you know, the finances become a very big part of having a child. Like, it is so real. And it's just unbelievable the amount of money that you spend so fast. Don't you find?
Oh, yes.
And I just want to say a huge shout out to everybody that has been in the community, that has been here and has bought a present for Stevie, whether it has been sorry it's okay, you're okay, whether it's been one little soda.
Oh God, Tracy,
I'm sorry, it's just so nice, you know.
It is very nice.
And I feel so blessed about everybody who has helped us out because it's so much money and you don't think about it.
No, you don't, because no matter what, as a parent, you're going to find it. So whether it's formula, whether it's a high chair, when you need something, especially when it's for your children, you will find it, Trey, and you're doing a good job.
No, I know I am, but I'm just like, it's just such an overwhelming thing, and I never realized how important giving a baby gift was until like now I'm going through it, and I'm like, I appreciate everything that has come through to me. And you know, in just my Tricky's Corner, I just want to say, like, be a blessing to somebody else because it's really appreciated.
God, Trey. She's so grateful. And as she said, just be a blessing to somebody. Because sending a little blanket, although to you, you might be like, oh, this little blanket don't cost a lot.
Or it's just a $6 or whatever.
It means a lot.
But to everybody, you know, and
the village is very important.
It is. And I just want to remind everybody who you're baby planning and stuff, like, just to do some financial planning as well. Because Scott and I are lucky that I really thought about this. I really thought about, how our finance is going to work and how it's going to work for the two of us. And, you know, Scott and I need for nothing. We really and truly don't. And Stevie will need nor want for anything. But I think about it all the time. Like, I opened Stevie's room door and I was like, wow, this is a room of blessings right here. Like, it's just so, I just can't get over how fabulous it has been to just feel so good about welcoming my child into this world. And I just want to say, you guys, just make sure that when you're getting pregnant, that you have your finances in order, that you make sure your village is there for you. And there's nothing that you can do wrong for your child because you're doing the best that you can. And you know, it's a hard time for everybody going through this because when that doctor's bill comes in and when that hospital bill and that epidural bill and then you're having to buy baby formula, the breast pump, like it's very, very overwhelming. So, you know, take it easy on yourself as well. That's all.
No, Trey, it's okay. I'm here for you. Your community, your village is here for you.
No, I feel very blessed.
She's blessed. Really do. Look at mommy. Mommy, are you crying? I bet your mommy's crying. She's on here. Guys, thank you so much. I know I got cussed off the last time Tracy made a flinch and I didn't hug her, but it's not really in my personality, but I'm giving a genuine hug right now. It's more of a press. I do presses. Okay, don't cuss me. All right, everybody, thank you so much for joining us this week on another episode of Tuesdays with Tricky. We'd like to thank our guest, Dr. Daryl Daley, who told us how to solve Tracy's smelly pom-pom and her bloody batty. You know, so thank you, Doc, because honestly, I know I must take more boric acid to help with the uku.
But you're a cockroach, so boric acid works for you.
Exactly. So I shall cockroach on everybody in my headband wig today, provided by Hemorrhoids. Thank you, everyone. Thank you so much. I'll make sure you tune in again next week, Tuesday at 1:30 for another episode of Tuesdays with Tricky.
And I just love how this hibachi bowl can done.
It's like never ending. It's like Jesus and the fish, Tracy and the hibachi bowl. My gosh. Thank you, everybody. We'll see you next week.
Okay, bye.